Many girls not given breast most cancers surgical procedure choices. Girls with breast most cancers usually really feel rushed to decide about the surgical procedure, and a few of them would possibly profit from extra time and higher instructional supplies to tell their remedy decisions. Two latest research recommends. One examines surveyed 487 ladies after they underwent both a lumpectomy that removes malignant tissue whereas sparing the remainder of the breast, a mastectomy that removes the complete breast, or each procedure. No matter what path they took, at the least 1 in 5 ladies mentioned selecting shortly was extra vital than making a knowledgeable determination, and at the least, as many sufferers felt like they didn't have all of the details earlier than their operations. A breast most cancer's prognosis can really feel like an emergency when you find yourself the affected person, mentioned lead examine creator Dr. Sunny Mitchell, a breast surgeon in Stratford, Connecticut. There may be really loads of time to evaluate all remedy choices since survival charges are very excessive for early-stage breast most cancers and don't change if a lady begins remedy inside a number of weeks, Mitchell mentioned by Electronic Mail. Most early-stage breast most cancer sufferers have both the lumpectomy or mastectomy, and plenty of them get chemotherapy or radiation afterward to destroy any remaining irregular cells and scale back the chance of most cancers coming again. Within a survey, solely 47% of lumpectomy sufferers, 67% of mastectomy sufferers, and 28% of ladies who had each procedure mentioned they felt fully knowledgeable earlier than they'd these at surgical procedures, Mitchell and colleagues discovered. A fast determination was extra vital than a knowledgeable determination for 35% of the lumpectomy sufferers, 31% of the mastectomy sufferers, and 22% of the ladies who had each procedure. A separate examine in the identical journal provides a technique to assist ladies to perceive their choices. For that examine, researchers randomly assigned 227 ladies newly recognized with breast most cancers to make use of a web-based decision-making device or to learn supplies obtainable on websites run by teams just like the American Most Cancers Society and the nationwide Most Cancers Institute. The entire ladies participated within the examine earlier than their first surgical session. With the choice help, half of the ladies scored at the least 80 out of 100 on checks of their information about breast most cancers and remedy choices, in contrast with a median rating of 66 for ladies who reviewed materials on numerous websites. On the identical time, 72% of the ladies who used the choice help acknowledged that they might wait a number of weeks to make a knowledgeable remedy selection without affecting their survival odds, in contrast with simply 54% for the opposite ladies. Girls profit from receiving high-quality details about breast most cancers previous to their first go-to with a surgeon, senior examine creator Dr. Heather Newman, a researcher on the College of Wisconsin College of Drugs and Public Well-Being in Madison, mentioned by Electronic Mail. Determination aids will help ladies make clear their private values and preferences, for instance by specializing in whether or not they need to keep away from radiation or consider preserving their breasts, mentioned Dr. Claire Lee, a most cancers researcher at the Ohio State College Wexner Medical Middle in Columbus. This course can even put together ladies to speak to their supplier about remedy choices and make a knowledgeable determination, Lee, who wasn't concerned with the examine, mentioned by Electronic Mail. Girls can nonetheless make an informed selection, aided by info online, even after they don't use a choice help, Lee added. Girls ought to search for info that presents a number of remedy choices and the professionals and cons of these choices, not simply the professionals, Lee suggested. Making a choice is about extra than simply info, it's additionally about being clear on what's vital to you and being ready to debate these items actively along with your supplier.